Hi everyone, welcome back to my YouTube channel. Today we are going to talk about mandible, and here at the side you can see the diagrammatic representation of mandible showing different parts of mandible for the reference. So let's start our topic with introduction. Mandible or lower jaw bone is the largest and strongest facial bone. It is the only movable bone of skull excluding the ossicles of middle ear that are also movable. It plays a central role in mastication, speech, and facial aesthetics. Talking about its anatomical structure, mandible consists of horizontal body and two vertical rami that extend upward from the posterior ends of the body. Body of mandible it has ramus of mandible. First we will talk about body of mandible. It has alveolar part that contains socket for the lower teeth. It has base that is a lower border providing support. It has mental protuberance that is a triangular bony prominence at the chin center. It has mental foramen that is located below the premolars, transmit the mental nerve and vessels. Further, we will talk about ramus of mandible. It has coronal process that is anterior projection for attachment of temporalis muscle. It has condylar process that is also called as condyle. It is posterior projection that articulates with the temporal bone to form the temporomandibular joint. It has mandibular notch that is the curved depression between the two processes. It has mandibular foramen that is internal surface opening for the inferior alveolar nerve and vessels which run through the mandibular canal. Now let's talk about articulations of mandible. The mandible articulates only with the temporal bone at the temporomandibular joint. This joint allows for hanging and gliding movement that is necessary for chewing, speaking, and yawning. Talking about muscle attachment, several critical muscles attach to the mandible, including muscles of mastication that include masseter muscle, temporalis muscle, medial and lateral pterygoid muscle. Then muscles of facial expression and speech also attach to the mandible. They include platysma muscle, digastric muscle, mylohyoid muscle, and geniohyoid muscle. Talking about development and ossification, it develops through intramembranous ossification, beginning with two halves that fuse at the midline during the first year of life. The mandible canal forms around the inferior alveolar nerve as the bone matures. Functional significance: chewing. It houses lower teeth that serve as a primary lever for mastication. Speech, as it supports tongue and lip movement. Facial aesthetic, as it defines the contour of the jawline and lower face. Protective role, as it shields nerves and vessels traveling through its internal canals. Talking about clinical significance, is mandibular fracture, that is common in trauma, often near the angle, condyle, or symphysis. Second is TMJ disorder. It can cause jaw pain, limited motion, and clicking noises during movement. Third is anesthesia, as inferior alveolar nerve block is a common dental injection targeting the mandibular foramen. Fourth is orthognathic surgery that involves surgical repositioning of the mandible to correct bite misalignment or facial asymmetry. Now let's talk about conclusion of this lecture video. Mandible is a dynamic multifunctional bone serving as the foundation of lower face that is a key player in chewing and speech, and a structural marvel in its ability to move independently from the rest of the skull. Whether you are enjoying a meal, forming words, or slimming for a selfie, this bone is hard at work. So this was all about mandible. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.